Professor Carlos from Coimbra University. He is a dignified, distinguished pulmonologist and interstitial lung specialist. And we'd like to have his thoughts on the current European Respiratory Summit, which is going in Mumbai, and he would like to shed light on the overall scenario of the respiratory disease and the domain expertise he has. Yes, sir. Over to you.
Thank you.
About the ERS.
I think this is a very important meeting. We started to increase the relation between the European Respiratory Society and the Indian Chest Society around 10 years ago, when we decided in the European Respiratory Society to enlarge the membership with agreements with national and regional societies. And since then, the Indian Chest Society has been always a very active society within the ERS. Now all the members of the Indian Chest Society are also members of the ERS,
okay.
And it is a very active society promoting very good collaboration, not only coming to our meetings, for instance, to our annual Congress, but also organizing here in India many programs in collaboration with us, as it is the case today. Well, respiratory diseases are really an increasing field of diseases for many reasons. For instance, aging is an important reason for the increase of respiratory diseases. Many of the main respiratory diseases are diseases of the older population. Pollution, atmospheric pollution, and also pollution in the work and pollution at home, but mainly the pollution also related with climate changes are really an important cause of respiratory conditions. So I think it will continue to increase, as we are assisting now to an increase also of climate changes and air pollution, which is, by the way, the first cause of the first main global threat for diseases identified by the WHO. So we are unfortunately one of the highest diseases among the all diseases, and it is to be increased in the near future.
Sir, could you please also give some thoughts and some insights on the interstitial lung disease, and what kind of epidemiological studies have been done, what kind of researches have been done, and where is India, what needs to be done when it comes to India as far as therapy is concerned or the diagnosis is concerned?
Yes, this is a very important question. Interstitial lung diseases are a very large, very broad group of diseases, some coming from the occupational field, some coming from the autoimmune diseases and the involvement of interstitial, some are idiopathic without any identified cause, and this is a group of diseases that might be and have to be understood mainly in two ways, I would say updated ways. First, it's important to have an early diagnosis,
okay.
And sometimes we do not get very early to these patients. These patients are lost with other diseases because they have a lot of comorbidities, and it's difficult to identify early. So the symptoms are very, I would say, not specific, and sometimes it's difficult to identify early an involvement of the interstitial field in the middle of other diseases. So it's important to create awareness. Not only, of course, the specialists are perfectly aware of this need, but to create awareness among the primary care settings. So it's important to get to the GPs and to
general physicians,
and to
primary healthcare centers.
Yes, and to create awareness of this, because among patients that are being treated with, for instance, cardiac diseases or even COPDs or obstructive airways diseases, there might be some that are already developing interstitial lung disease. So early diagnosis is important. Another point is the early identification of the actual concept of progressive pulmonary fibrosis, because we know that some of the entities that compose the interstitial lung diseases might have this phenotype, this behavior of having a more progressive behavior, progressive fibrosis, fibrotic behavior, and it's important to identify it very early, because not only because of the prognostic is worse, but because that might be indication for antifibrotic therapy.
Okay.
We have now antifibrotic
Therapy
drugs. Yes, and we have some drugs that are also in research, and it will be soon. They will be those molecules can will be I would say these studies will finish soon.
Okay.
It's important to get there early for the possibility of having these patients included in these treatment trials.
Okay, so the trials are global trials or India-centric trials?
Global trials. Global trials.
So how many trials are happening in order to get the right molecule at the point of care?
We have now.
And what are the molecules available at the point of care at the moment?
We have 2 antifibrotic available now.
Are they affordable, accessible
yes,
in India?
Yeah, in India. We have 2 antifibrotic molecules that are really, that change the profile of survival of this patient, which is important. And now we have other molecules that are really in the line, in the research and in clinical trials to be finished this year.
Okay.
This year,
a new breakthrough molecule will be available globally and in India.
Hopefully
by next year.
We do not. Yes, hopefully
in a couple of years we can expect.
Yes, or less, because we will have the results this year.
So it will be under the patent regime, na? The innovator.
So that's why it's important to get early to the diagnosis and to get early to the diagnosis of the more progressive diseases.
So the drugs which are available today, are they off-patented drugs or are they under the patent regime? Which are available today?
Yes.
They are off-patent.
The 2 antifibrotic that are already available have already 10 years of existence. So it's something that, and you have here in India, and we have in other parts of the world the generic molecules also available for being antifibrotic.
Fibrotic drug is available in India, which is available and accessible and affordable. Currently. Can you name the?
Yes. One is the nintedanib, and the other one is the pirfenidone.
Can you repeat it, sir? What is it?
Nintedanib. Once, and the other one is pirfenidone.
Okay. So these are available at tertiary care centers, or are they available at the primary healthcare center also? These kind of drugs, the tertiary care centers. Yes. And how many? What is the demand supply gap? As in, how many people need to be addressed for this kind of interstitial lung disease in India vis-a-vis globally?
This is a very difficult question, because there are many. Well,
are these people diagnosed? Is the people who are today suffering from interstitial lung disease, have they been reached out, or are they? Is it the untapped potential or untapped?
We need more diagnosis.
More diagnosis.
Many
diagnosis tools.
Yes, not only more diagnosis, but earlier diagnosis, because the time since the patients start to have symptoms until the moment they are diagnosed with interstitial lung diseases, it is normally more than 1 year.
Okay, so what is the incidence of such disease in India?
I don't know. It's
Acha.
difficult because there are some causes that might be important here, like occupational causes. So
Acha,
occupational
occupational
causes, and I think for me it's very difficult to know exactly the percentage of that.
But it needs an urgent.
Yes, it needs, because maybe many patients, it's like that everywhere, many patients are not identified yet.
So, what are the symptoms, and how we can achieve the right kind of screening and therapy?
Yes.
Yes.
The symptoms are very basic, I would say. It's shortness of breath, so it's fatigue, shortness of breath, and cough.
Okay.
Cough without sputum. So
Okay.
cough, dry cough, and shortness of breath and fatigue.
Okay. So, how do we achieve that screening capability and the therapy? Your suggestions and your recommendations.
It's fundamental to make the lung function study.
Okay.
Because in the lung function there are some parameters that are really clearly indicating that there is an interstitial involvement, and also radiological assessment, namely through the high resolution CT scan. So
High resolution CT scan.
High resolution CT scan is fundamental to identify the interstitial diseases.
Okay, so do we have this diagnostic capabilities and therapies available in India today?
Diagnostic and therapies.
So what is the way ahead, considering the event which is taking place in Mumbai, which is the European Respiratory Society in association with Indian Chest Society? What is the way ahead?
It's to improve awareness. It's fundamental to improve awareness of this possibility of patients that are being fatigued, that have fatigue, that have shortness of breath, having an interstitial lung disease that is being developed.
Okay.
Because many times these patients have also some cardiac heart failure, for instance.
Okay.
And sometimes it can be difficult to identify interstitial lung diseases among other comorbidities. So it's important to improve awareness among not only the pulmonary specialists. They are aware of that, and they should be aware, but mainly in the primary care setting.
Thank you, sir.
Thank you.
We have Mr. Prof.
It was a
Thank you.
pleasure. Thank you. My pleasure.